Greetings, learners. Welcome again to our topic today in Health and Wellness Unit. We are in our 6th topic, and we are going to look at common respiratory diseases. I'm your facilitator, Anastasia Kamwenda. In the last two topics, we've discussed non-communicable diseases, that is diabetes and hypertension. In this topic, we are going to look at the respiratory diseases, most of which are communicable, meaning that they can spread from one person to another. Respiratory diseases are important since some can be very contagious. We know some of them, like the coronavirus. It can spread from one person to another. We have the TB with the tuberculosis. So respiratory infections are important. One other thing to note is that some diseases have developed resistance to microbial treatment or to antibiotics. This is mainly seen in tuberculosis, in pneumonia, chronic obstructive pulmonary disease, and also cystic fibrosis. These are diseases that have developed resistance to antibiotic treatment. So today we expect to learn communicable diseases, the causes of the disease, and also signs and symptoms, and their prevention and their management. Our special focus will be placed on tuberculosis and also on pneumonia, and with deeper exploration into the causes, the risk factors, signs and symptoms, the diagnosis, prevention, complications, and available treatment, and also the management strategies for these conditions. So as an introduction, we find that there are many types of respiratory diseases. So we have mentioned some of them, like asthma, we have tuberculosis, we have another one called obstructive sleep apnea. But we find smoking and exposure to certain substances are common risk factors for these conditions. So respiratory diseases are conditions that affect the tissues involved in breathing, which include your lungs and the airways. So what are the common respiratory diseases? We've mentioned some of them. We find respiratory diseases are a frequent cause of health problems and death across the globe. So we are looking at, in this topic, we are looking just a few of them. The first one we are going to look at is asthma. I'm sure we have all heard of asthma. It's a condition that's characterized by inflammation, that is infection and narrowing of the airways, leading to wheezing, coughing, and shortness of breath. One is not able to breathe properly. Among the common triggers are allergens, cold air, and also stress. When is stressed, they can end up with asthma. The condition is addressed by using inhalers and avoiding all sources that can trigger asthma. So we are going to look at the other one we call the chronic obstructive pulmonary disease. It is composed of chronic bronchitis, that is the bronchioles that are infected, and emphysema leading to airflow obstruction. The key cause of the disease is cigarette smoking or tobacco use. Its treatment modalities include bronchodilators and lifestyle changes. Then thirdly, we are going to look at pneumonia. It is a type of infection that will inflame your lung air sacs. The infection could be bacterial, it can cause viruses and also various fungal types. Hence, the treatment of pneumonia is generally determined by its root cause. So that if it is bacterial, you need antibiotics. If it is fungal, you need antifungals. If it is viral, you may need to use the antivirals. The other condition we are going to look at is bronchitis. Bronchitis refers to the inflammation of the bronchial tubes, which can be acute, that is a short term, comes frequently and takes a short term, or chronic, long term. It leads to cough and mucus production. Acute cases are often viral, while chronic bronchitis is linked to smoking. Then we have the other condition we are going to look at is tuberculosis, or what we call in short TB. It It is a contagious bacterial infection that occurs in the lungs, leading to serious cough and chest pain, and also lethargy. Antibiotic treatment for this one, because it is caused by a bacteria, we use antibiotics to treat, but it is treated over a long period of time. So we say it's long term. So the other common respiratory disease we are going to look at in this topic is lung cancer. It's mainly caused by smoking and involves abnormal cell growth in the lungs, leading to a persistent cough and loss of weight. Then the other condition we are going to look at is pulmonary embolism, a blood clot that clogs an artery in the lungs, causing sudden shortness of breath and very severe chest pain. This one is a medical emergency. One should go to the hospital very fast, and you are treated with blood thinners or things to dissolve the clot that has formed, or even surgery. Sometimes the clot needs to be physically removed through surgery. Then the 8th condition we are looking at is cystic fibrosis. This is a genetic disorder leading to thick mucus buildup in the lungs. This leads to frequent infections and breathing problems. Medications, therapies, and often antibiotics help in the treatment of cystic fibrosis. Then the other condition is sleep apnea, characterized by repeated interruptions in sleep, where a person sleeping breathes during sleep, but leads to loud snoring and daytime drowsiness. So the most common treatment is through lifestyle modification, the using of what we call the CPAP machines. We'll see what those ones are. Then when we look at some of the causes of the respiratory infections, respiratory diseases, the first one, of course, is infections. We had mentioned that one earlier. So there are numerous causes of respiratory diseases that can affect the lungs and airways. Then we have the first one, we have said the infections. It can be the viruses, like the flu virus, what we call the influenza virus. We have the COVID-19. We have the ones that cause the common cold that can lead to bronchitis and pneumonias. These are viruses. Then we also have bacteria, can also cause respiratory infections, like the Mycobacterium tuberculosis or the bacterial pneumoniae. Then we also have environmental factors as causes of respiratory diseases, air pollution. Air pollution can lead to irritation of the respiratory system due to pollutants such as smoke, dust, and chemicals that may eventually cause respiratory distress such as asthma and chronic bronchitis, or what we call emphysema. Then we also have other causes of respiratory conditions, is occupational hazards. We can have lung diseases such as asbestosis or pneumoconiosis are caused by asbestos or silica dust or coal dust, which one may be exposed over a long time in your workplace if you are working with this, where you're getting this dust. Allergens include pollen, pet dander, mold, and dust mites that could cause asthma or allergic rhinitis. Smoking and tobacco exposure, the greatest list for the chronic obstructive pulmonary disease is smoking, as well as lung cancer and emphysema. And also exposure to short-haired smoke exposure may be a risk for respiratory conditions. Then another cause could be genetic cause. And many other causes. So the core prevention strategies are essential practices recommended for everyone. So they provide a foundation of protection of you and your loved ones. So one of the things that is recommended to prevent the respiratory infections is immunizations that we find are recommended, and especially the childhood immunizations that are done when one is young. So let's keep up to date with immunizations and any other that the country can recommend, like in the case of the COVID. Then we also need to talk to a doctor or trusted healthcare provider about what may be recommended for you and your family. Then practice good hygiene, like washing of hands and regularly and cleaning commonly touched surfaces. Then let's ensure that we step for cleaner air as possible in places where people live and work. Let's ensure we ventilate even our houses. They are well ventilated. When we are sick, let's seek medical advice. Then we also need to use precautions to prevent spread of the respiratory infections. Like when one is sick, stay at home, stay away from others, or you use protective equipment so that you don't spread to other people. So in conclusion, what we are saying, respiratory diseases are disorders of the airways, the lungs, and other structures responsible for respiration. They can result from infections, smoking, environmental toxins, and genetic causes. The discussion of common respiratory diseases would be incomplete without increasing awareness in order to take measures for prevention. What is very important is prevention. And we have seen in infections, respiratory infection can also be caused by environmental triggers, smoking, genetic predisposition. But the most important we have said is prevention, is identifying symptoms involved, which include chronic coughing, shortness of breath, and wheezing. Let's also have proper diet. Let's remain active, and we reduce our exposure to harmful substances. So kindly, thank you for listening. Let's interact with all the learning and evaluation activities in this topic, including the quiz. And remember, whenever we do an activity, we remember to submit. And then this topic is important in terms of its impact to the individual, community, and also the health systems. Once again, thank you so much, and do the exercises and interact with the topic.